Why do my eyes look like this, and what can I do to fix this? My eyes look so different now, but I don't know what it is. Can someone help me on how to fix my eyelids and how to go back to having a perfect eye shape?
Thank you for your question. You submitted a photo with a question where you're asking why your eyes look different and what is the situation and what can we do to help this asymmetry or lack of symmetry. Well, I can certainly help you with understanding this. I'm a board certified cosmetic surgeon and a fellowship certified oculofacial plastic surgeon. That's someone who's specialized in eye surgery and then super specialized in plastic surgery of the eyes, and in practice for over 20 years in Manhattan and Long Island. And concerns about asymmetry is something we deal with every day. So when we look at your photos, at the most basic level, you can just look at the skin of the over your left eye compared to your right eye. And what do you see? You see a little more skin over your left eye compared to your right eye. Now, understanding that the human body is naturally asymmetric. That means that we're created in terms of embryology from in the center, so everything joins and fuses in the middle. And underlying bone structure is often responsible for how the soft tissue over the bones are oriented. So in situations like yours, it would be important to at least understand from a more global perspective by stepping back and looking at your face and seeing the projection. In other words, if you look at yourself in a different way, you may notice that the cheekbone on one side is more prominent than the cheekbone on the other side, or that the eyebrow is lower slightly on one side compared to the other. Now, I try to minimize the amount of procedures to help achieve symmetry because we can never do enough to get perfectly symmetrical. And there has to be a rational approach to doing this. So typically for someone like yourself, we would sit together and I would roll the skin up on the left eye in your situation to show you how revealing more of your eyelid will actually create a little bit more symmetry. I always say to our patients is I can make you more symmetric, but I can't make you perfectly symmetric because there's too many factors and too much structure involved that would not be amenable to surgical or any other type of correction. So, and the other thing is that unless someone has a significant asymmetry, most people don't notice these things. When we look at ourselves, we look at ourselves with tremendous detail. And when we look at that detail, we also magnify that. Now, if you were to ask your friends and family if there's anything wrong with your eyes, they most likely will not notice what you're describing. Now, I could be wrong. They may be very precise in how they look at you. But nonetheless, I think that the bottom line is that in terms of your eyes, the hooding on the left upper eyelid is greater than the hooding on the right upper eyelid. There's a little bit of puffiness under your eyes, and that's also something that can be addressed. So I think the take-home message is to make sure that you don't try to go for perfection. Certainly, I should have also mentioned that be aware if this is a change, and if it is, let's see if you could compare previous photos to the way you look now, and then determine if it's practical for you to have eyelid surgery. So I think you should meet with qualified, experienced cosmetic surgeons. My bias is always towards specialization specialists, people who really know eyes and do eyes a lot and are focused on cosmetic. And learn about your options. You know, the photos are helpful, but a real physical examination cannot be replaced. So I hope that was helpful. I wish you the best of luck, and thank you for your question.